my impression is that the pandemic provided a real world example of why it's so important. I think lots of people paid lip service to the need for more interaction amongst social sciences and, more traditional sort of hard or biomedical science types. And it did happen occasionally, but I would argue, not with the frequency that it probably needed to, because in some ways, I think some people thought that it was impractical or it's different, because the reality, of course, is that the more disparate the fields are, the harder it is to have a true collaboration. Like, it would not be easy for me to sort of like publish a paper based on the way that I normally do my work with a social scientist, right? But I think there are bigger picture issues that those collaborations benefit from, and I think what's happening now is helping to fertilize those fields, because universities are becoming places that are more interested in impact beyond publications, like real community and societal impact. And that's where I think there's immense opportunity to synergize in bigger and not maybe in some cases more important ways, but certainly with a lot more intensity. Like I think that we've been hampered in the past by trying to think about like, how would we ever publish a paper if we collaborated together, right? And there are probably ways, but I can see how, the stuff I'm putting in a dish, like, is not going to have an obvious intersection with social sciences all the time. But I think now academics are understanding the benefit and the need to be more outward facing, as opposed to sort of the old reclusive view of academics, and that is having a really positive impact. And I think for those who are skeptical about the place of humanities in health and medicine and biomedicine in particular, I think it's always been more understood in patient-facing clinical disciplines that there is a clear and critical role for humanities. I think it wasn't as well understood how on sort of like drug development, device development, biomedical innovation, how much intersection there was there. And I think the pandemic just like highlighted this in a very intense way for all of us.
Yeah, I agree, and I will add to that I don't think that these are new questions, right? But I think the pandemic made it very clear and obvious that you need a holistic solution to big problems, and I guess that's what Global Nexus is trying to do. How do you leverage the knowledge of different disciplines to make sure that we have the best possible outcome in terms of health and well-being and disease control, right? How do we lower the burden of disease amongst people? So I think that's where it comes in terms of complementarity, right? Like where you join hands together for that bigger goal, which is to make lives better and improve the the condition of lives, and make disease manageable, create a better, improved society, right, where people can trust doctors and trust medicine and trust health, right?
Absolutely, yeah. And I think that really is, Nexus is a partnership focused organization, and I think exactly what you said is right, that like we want to lean on the deep expertise that people have in order to, no single person can have all of the competencies needed to make transformational change, and so we have to work together and leverage our collective strengths in a unified way in order to have those big transformational benefits that we want to have.